everyone, in today's world everyone is complaining of tension, and I'm sure you don't come across a single person who will say that he has no hypertension or no stress. We have to blame the modern lifestyle for this, where we are not having time for ourselves. We are spending more time at our office, at our business, and more time is spent in traveling and on social media, like answering emails and answering phones. So because of this stress and tension, it is having physical as well as mental effects. So that's why we are having increase in incidence of blood pressure, diabetes, and myocardial infarction or heart attacks in younger population compared to 25 years ago. So the incidence of blood pressure is really increasing alarmingly. If you see in urban population, almost 33% of the people are having blood pressure, and in rural population also 25% are having blood pressure, and unfortunately less than 50% of the people are aware about it. Now when you say 33%, it means 1 out of every third person whom we are seeing is having blood pressure, and unfortunately he is unaware about it because they don't have any symptoms. Now, definition of blood pressure in today's, we are talking of control of 130/80. So in short, any adult above the age of 18 who is having BP more than 130/80 is supposed to, means we are labeling him as a patient or case of hypertension. And our targets over last 1 year have been brought down by all the societies, hypertension guidelines of even India, where we are targeting the blood pressure level of 130/80. Now why are we worried so much about blood pressure is because it has become a major public health menace, whereby almost 40 to 42% of cardiovascular deaths, by that I mean deaths due to heart attack, due to angina, due to load on heart, are due to blood pressure, and similarly almost 50% of stroke deaths. That means we mean paralysis, where there may be bleeding inside the brain or blood supply to a particular part of the brain is hampered, is due to blood pressure. Now coming to the causes, the exact cause of blood pressure in majority of the patients is not known. Almost in 90% of the cases we won't have any cause. But generally what are the commonest issues are the family history of blood pressure. Means suppose you have some relative who is having blood pressure, then your chances of getting blood pressure are high. Not necessarily that all the 4 siblings will get it, but your chances of getting BP are high. Then lack of exercise, physical exercise. Third is all eating modern junk food. Because of all these factors, the weight increase is occurring, so we are becoming all overweight, and plus added to that the stress and tension. So these are the main causes of blood pressure. Of course there are certain treatable causes of blood pressure which are seen in less than 10% of the patients, which we call in medical term as secondary causes of blood pressure. Generally they are due to kidney disease, due to thyroid, then due to some drugs like oral contraceptives, but your doctor will know the best who needs investigations for these rarer diseases.